Welcome to Sunday's Health Update with Dr. Tabah from North Shore Gastroenterology.
Good morning. We're fortunate to have with us this morning Dr. Naem, who joined us here recently at North Shore Gastroenterology from the Ohio State University, where he did his gastrointestinal training. Dr. Naem, we hear a lot and we see a lot of patients in our practice with inflammatory bowel disease. Can you tell our patients what IBD is?
Just like you said, IBD stands for inflammatory bowel disease, which is actually two distinct diseases known as ulcerative colitis and Crohn's disease. It's a chronic remitting type disease, which basically means that there's episodes of active disease or flares or symptom-free periods called remission.
And in those patients, how can we tell whether they have ulcerative colitis or Crohn? Is that important to tell?
It is very important. It depends on the extent of disease and the location of the disease. Crohn's disease can affect anywhere from the mouth to the anus, where ulcerative colitis affects mostly the rectum and the colon.
Now, traditionally, we have treated these patients with medication like steroids, what have you, with a lot of side effect. It's my understanding and treatment options have changed quite a bit. What can you tell us about that?
The mainstay of therapy was 5-ASA or steroid-type medications, but now, more importantly, we have medications called biologics. Biologics are antibodies that are directed towards molecules that cause inflammation in the body. In fact, we actually use these medications in conjunction with our other medications, known as immunosuppressants or even the 5-ASA or steroids, to help get you into remission.
Now, a lot of these patients come to us at a very young age, and they and their family are very concerned about the type of life they're going to lead. What can we tell them about what we can offer them in treatment, and how can that change their life?
Just like you said, it's a chronic disease, but if we are very aggressive with our therapy, we are able to help these patients lead a symptom-free life. They can have children, they can get married, and just live a normal life.
Well, thank you again for being with us this morning, and thank you for this very helpful information that
You're
you
welcome.
had.